ASGE Secretary-Elect Dr. John Vargo from the Cleveland Clinic joins me now. You have a very busy week ahead, an exciting week. Talk to me about ASGE's focus this week.
Well, the pinnacle of our focus is always our postgraduate course, and it's co-directed by three of really the luminaries in endoscopic therapy, education and research. Brenna Bounds from Massachusetts General Hospital, Grace Alta from University of Michigan, and Brian Jacobson from Boston University Medical Center. They put together a fantastic portfolio which includes didactics, video how-tos, as well as case presentations that are really going to entice the participants to really develop evidence-based as well as practical approaches to endoscopic therapy and management of a variety of gastrointestinal disorders.
Really highlighting and honing in on the best endoscopic practices.
Absolutely. For example, the initial part of the course is going to focus on esophageal diseases. We've had a renaissance of technology in Barrett's esophagus, and we know that as opposed to 10 years ago when everyone with high-grade dysplasia in Barrett's esophagus was relegated to surgery, we now have endoscopic therapies for this. And Ken Wang from the Mayo Clinic will be going over the armamentarium of just how to approach high-grade dysplasia in terms of radiofrequency ablation, endoscopic mucosal resection, and cryotherapy. So that'll be a very important part of this. Moving down the gastrointestinal tract, we can talk about the small bowel. And again, there's been another renaissance of technology. We have capsule endoscopy. You swallow the capsule and we have this beautiful video of the mucosa. But we also have other non-invasive imaging studies that are now coming to the forefront, such as MR angiography and CT angiography. And Amrita Sethi from Columbia University Medical School will be discussing when, where, and how to use these. And then when you find the lesions, how do you get to them and how you treat them? And I think the real anchor of the program will be the colonoscopy piece, and that is, as all gastroenterologists know, it's really one of the pinnacles of evidence basis in terms of over the past 20 or 30 years, we've been able to find the colon polyp to colon cancer sequence. And what we're going to be talking about there is how do you optimize your ability to see colon polyps? We have a variety of technologies available, Dina, and how do you optimize your observation in order to maximize the probability of finding those polyps, resecting them, and thereby removing that risk for developing colorectal cancer.
But also offering patients these non-invasive diagnostic tools, I think, encourages them to see their doctor and get screened and be able to really save more lives.
That's exactly right, Dina. We certainly know that the higher your adenoma detection rate, that equates to a lower risk of colorectal cancer, and that's what the ASGE is all about, is really promoting gastrointestinal health through endoscopic research and practice.
I know you got so many terrific sessions, but some of the most exciting, I think, are the hands-on.
ASGE is all about hands-on, and there's I'm very excited about this. Where can you spend an hour or two with a world expert on an animal model interacting about various endoscopic techniques? We have a hands-on station that are going to be for ERCP, endoscopic mucosal resection, endoscopic submucosal resection, and then another area which is becoming of increasing importance, and that is endoscopic suturing, how we're able to handle perforations that before this would almost invariably go to the operating room, and we now have technology that can handle these types of things.
Such an exciting time. What do you really hope attendees take away from ASGE's program?
Well, I think there's an incredible bandwidth of activity for everyone, and I always look at this. I try to just distill it down to this. We're all physicians. Our sacred responsibility is to take the best care of our patients, and I think that is the most important thing. And we can do that by many different ways. Learning new techniques to augment our skills, I think is very important. Bringing the state-of-the-art from this meeting to your practice and to your patients to really augment their care I think this is why we're here. This is the raison d'etre for Digestive Disease Week.
And that is what is so exciting. It's helping not only the physicians, but the people you treat as well. Dr. John Vargo, thank you so much, ASGE Secretary-Elect.
Thank you, Dina.